Yersina, Pasteurella, Francisella. They are gram-negative bacilli showing a bipolar staining with methylene blue. They are non-motile except Yersina pseudotuberculosis and Yersina enterocolitica. These bacteria are primary pathogens of rodents and men and are accidentally infected. Yersina pestis is a short ovoid gram-negative bacilli about 1.5 micrometer into 0.7 micrometer in size with round-ended and convex side, occur singly in short chain or in small groups. When stained with methylene blue, it shows a bipolar staining safety pin appearance with two ends darkly or densely stained and the central area clear. The pleomorphism is very common. The bacterial body is surrounded by a slime layer, envelope or capsule. It is non-motile, non-sporing and non-acid fast culture. The organism is aerobic and facultative anaerobic. The optimum temperature for the growth, unlike most pathogen, is 27 degrees centigrade, but the envelope develops best at 37 degrees centigrade. It grows on ordinary medium. The nutrient agar. The colonies are small, delicate, transparent after 24 to 48 hours of incubation. Blood agar. The colonies are non-hemolytic and dark brown due to the absorption of hemine pigment. Other characteristics are same as that of colonies on nutrient agar. Mechanic agar. The colorless colonies are formed. Broth nutrient broth. The flocculent growth occurs at the bottom and along with the sides of the tube with little or no turbidity. A pellicle may form later. Ghee broth. When organisms are grown in flask with oil or ghee floated on the top, ghee broth, a characteristic growth occurs when hang down from the under surface of the oil, resembling the stalactites, stalactite growth. Biochemical reactions: catalase positive, glucose acid, mannitol positive, lactose sucrose negative, maltose positive, indole urease negative, MR positive, VP negative, citrate negative. Resistance: Yersina pestis is destroyed by heat at 55 degrees centigrade in 15 minutes. It is easily destroyed by sunlight, drying and chemical disinfectant. It can survive for several months in soil or rodent burrow. Antigenic property: in antigenic structure, the antigenic structure is complex and about 20 different antigens have been identified. Some of these includes fraction I or Fi, V and W protein, pesticin I, fibrinolysin, coagulase, murin and guanine, pig toxin, plague toxin, endotoxin. This Yersina pestis is a natural pathogen of rodent and causes a zoonotic disease called plague. Two natural cycles of plague exist: the urban and sylvatic plague. The plague is transmitted to man via bite of infected rat flea. The incubation period is 2 to 6 days. In man, plague occurs in three forms: bubonic, pneumonic, and septicemic. As the plague, the bacilli usually enters through the bite of infected rat fleas on the leg. The inguinal lymph node are involved, hence the name bubonic. Bubo meaning groin. If the bubonic plague is not treated properly, it may progress to meningitis. Meningeal plague: the pneumonic plague is a highly infectious form of plague involving the lung producing hemorrhage pneumonia. It can be transmitted from man to man by droplet infections, airborne route, and is virtually always fatal. The presence of bacteria in blood denotes septicemic plague. It usually occurs as a terminal event of bubonic and pneumonic plague. The massive involvement of blood vessel results in hemorrhages in skin and mucosa. Due to its manifestation, the disease is given the name Black Death. The mortality rate in bubonic plague is 50 to 75%. In pneumonic plague, almost 100%, and with the treatment, it is 5 to 30%. The plague is the greatest killer known to mankind. In 14th century, the plague pandemic known as a Black Death is believed to have killed about quarter of all mankind. Several pandemics have occurred between 1500 and 1720. The last pandemic occurred in 1894, causing more than 10 million deaths by 1918. During 1958 to 77, plague occurred in 29 countries, and India remains free of plague from 1967 to 1993. An outbreak of plague was reported from India in 1994. The cases were reported from Maharashtra, Gujarat, Delhi, Karnataka, Uttar Pradesh, Madhya Pradesh. In 2002, a short outbreak of plague was reported in Simla. Laboratory diagnosis. The laboratory diagnosis of plague includes diagnosis of plague in man as well as rodents. Early detection of plague infection in animals will help in prevention of plague. Specimen: pus or fluid aspirate from bubo in bubonic plague, the sputum and blood in pneumonic plague, the blood in septicemia plague, CSF in meningeal plague, splenic tissue on post-mortem. The direct microscopy: the sputum and aspirate from lymph node or stained with a gram staining and a methylene blue. The gram staining shows a characteristic gram-negative cocoa bacilli with methylene blue staining. The bacilli shows a typical bipolar staining. Other more specific direct staining method includes the use of fluorescently labeled antibody to envelop F1 antigen. Culture: the culture is made on blood agar medium and incubated at 27 degrees centigrade. The biochemical tests are performed to confirm the diagnosis. On ghee broth, there is a characteristic stalactite growth. The animal inoculation: guinea pig and white rats are injected subcutaneously with the exudates from bubo or with a 24 hours broth culture. The animals die within 2 to 5 days. Dipstick test: F1 glycoprotein can be detected by dipstick test using monoclonal antibody. It is a rapid diagnostic which produces a reliable result within 15 minutes. Antigen detection: the F1 glycoprotein antigen may be detected in aspirated fluid from bubo or sputum by immunofluorescence and ELISA test. Serological test: antibody to F1 antigen may be detected by passive hemagglutination or complement fixation test. The serological tests are useful for identifying plague foci as the test remains positive for several years after recovery from plague. Polymerase chain reactions: it is a rapid and sensitive method for diagnosis of plague in clinical specimen and freeze treatment. The tetracycline is the drug of choice in both bubonic and pneumonic plague. Early treatment is essential because of high fatality of disease. Prophylaxis: control of fleas and rodents. Spray insecticide inside the rodent burrow and houses to kill the fleas. Specific measure: killed vaccine is widely used for active immunization. It is a whole bacterial culture antigen of plague bacilli. It is prepared at Hafkin Institute, Mumbai. The Sokhi modification of a Hafkin vaccine is used. The vaccine contains 2000 million organisms per ml. The 0.5 ml of vaccine is injected subcutaneously, followed by 1 ml after 7 to 14 days. The boost dose is given every 6 months. Immunity lasts for 6 months. The vaccine should be given to health workers and those plan to visit plague infected area. The chemoprophylaxis: close contact of patient with the plague should be given a course of tetracycline 500 milligram 6 hours for 1 week. Yersina pseudotuberculosis and Yersina enterocolitica. These two organisms resemble Yersina pestis in that they are small gram-negative bacilli with bipolar staining and reservoirs of infections and rodent, wild and domestic animals. They differ from Yersina pestis by their motility at 22 degrees centigrade and not at 37 degrees centigrade, non-capsulated, urease positive, oxidase negative, and insusceptibility to Yersina pestis bacteria. For Yersina tuberculosis causes acute mesenteric lymphadenitis in men. Yersina enterocolitica resembles Yersina tuberculosis but differs from it in fermentative sucrose and decarbonating ornithine. The Yersina enterocolitica can cause gastroenteritis, mesenteric lymphadenitis, and septicemia in man. Disease occurs in fecal-oral route by contaminated food and water. The term Yersiniosis denotes infection with infection with Yersina and other than Yersina pestis. The laboratory diagnosis consists of isolation of organisms and indirectly by the demonstration of antibody in patient serum. Pasteurella maltosida. Pasteurella maltosida is a The Pasteurella maltosida. Pasteurella maltosida is a non-metallic gram-negative rod resembling Yersina, but it differs from it in being oxidase positive, producing indole and failing to grow on meconic agar. The bacilli is usually normally inhabitant of respiratory tract of variety of animals. A human infection is rare, but it may cause a septic wound following animal bite. Meningitis, respiratory tract infections, or appendicitis. The organism can be isolated from feces, blood, or from mesenteric lymph nodes. Blood agar, mechanic agar are used for growing these organisms. Cephsulodin, irgasan, novobiosin agar is a selective medium for recovery of Yersinia colitica from feces. Francisella tolerances. Francisella tolerance is the causative agent of tularemia, a major zoonotic disease of rabbit and other rodents. The human infection may occur by handling or eating infected meat or drinking contaminated water. It may also occur through tick bite. In humans, tularemia may present as a local ulceration with a lymphadenitis, a lymphoid like a fever with granular enlargement, or an influenza like infections. The organism is a capsulated non-motile gram-negative bacilli. It has fastidious growth requirement, and special media are used for isolation. It is highly infectious, and laboratory infection has been quite common. Laboratory diagnosis may be made by smear examination, culture, or by inoculation into the guinea pig. The patient's serum may be tested for agglutination antibody.